I don't think as nurses you're less immune to being scared and terrified of it like the general population. So yeah, we're all scared and we're all just trying to do our part.
You can only traumatize a person so much emotionally. You can only give them so much burden before people break. Every day that we're here, the person ends up crying. We're humans. We feel these things. We feel the exhaustion and we feel the stress. And it's getting bad.
Welcome back. Healthcare workers have spoken out about the heavy mental toll of caring for COVID patients. And while they're seeing the effects of the virus up close, many people, from COVID patients to those just stuck at home, are experiencing the mental health impacts of living in a pandemic. Joining me now to talk about this is Dr. Jessi Gold. She's a practicing psychiatrist and an assistant professor at Washington University in St. Louis, at the St. Louis School of Medicine. Thank you so much for being here. This is affecting a lot of people from all different walks of life who are at home, who are going to work, who are on the front lines, you name it. What do you say to people who are struggling mentally right now?
Yeah, I mean, if you just watch that video, it's hard not to feel for everybody that's going through this. I think that you can see it definitely affects everyone. I mean, what do you say? You say feelings are normal, that there are no wrong feelings, that this is a really hard thing for everyone, that anything you could possibly be feeling, from sadness to anger, from anxiety to fear, is normal. And if you feel it, you are completely entitled to that feeling.
There are those that are feeling it more intensely than others, and there has been reports and suicides going up. How do loved ones recognize the signs of somebody who might be having a very difficult time dealing with all of the uncertainty around us?
Yeah, I mean, I think there are definitely scales of worsening mental health crises, and the things to pay attention to for that are sleep. How bad are people sleep? How appetite and eating? Are people eating, socializing? Are they isolating? Are they interacting with you like they were? I think it's hard to say that in a pandemic, because there are definitely ways that our lives have substantially changed, but it is easier to see that somebody is not interacting with you in the same way that they were. Are they still wanting to be around you and your family? Are they still wanting to do the things with work that they were? And I think the longer that goes on, if it's a day, maybe that's okay. If it's more than a day, that might be more worrisome. And the longer and longer that goes on, then you might want to seek help. And there's always help available. And I think that's the thing that we always need to say and always need to be aware of.
Is there something that we can do in our everyday lives to make ourselves feel better? I mean, is it as simple as going outside for a walk?
Yeah, I think being outside is great. Exercise is great. I mean, wear a mask. I'm going to say that right now. You saw those healthcare workers. Part of the reason why they're so distraught is a lot of this is preventable. If we could have worn a mask, maybe our rates in Arizona would not have been so high, and maybe they wouldn't be so downtrodden and hard. It's really hard to be going through what they're going through. I think, wear a mask, go outside, spend time socially distancing with friends and family. You can still do that. It is possible to still do things that you enjoy. It is possible to still do coping things that give you pleasure without, just being inside all day.
While it does and can affect everybody to some degree, there are some segments of our population that are experiencing the mental health issues of this a little bit more acutely than others. And studies have shown on the younger side, the people who might not react as poorly to contracting the disease are reacting worse to the mental health implications. 18 to 29-year-olds feeling symptoms of anxiety and depression because they aren't able to see their friends, they can't see their families, or they're worried about infecting their parents or their grandparents.
I think the younger population gets a bad rap. We tend to blame them for a lot of things. We tend to say, look, they're just out enjoying themselves because bars are open and that's all they know how to do and they're just selfish. But really, if bars are open and they're sad, what do you expect? I think that they just are trying to do things to feel better. It doesn't surprise me that they're doing that because they're sad. And I think that that's the population that I see. And I think that it makes sense to me that they're looking for ways to see their friends and socialize and be around each other. And I think for that group, social media is really helpful. And that's a good way to reach out. That we're lucky we have that. We're lucky we have video chat and don't live where that's not a thing.
One of the positive effects of social media. Dr. Jessica Gold, thanks so much for spotlighting this with us today. We appreciate it. And if you or someone you know is experiencing a mental health crisis, there are free resources available at the National Suicide Prevention Lifeline. That number is 1-800-273-8255.